Good morning, good afternoon, and good evening from a very, very rainy Birmingham today. This is a patient who's come in with a piece of impacted dead skin right over the eardrum. Not a uniform case, not the atypical case that we normally see in clinic, but again, a lot of patients come in usually with this type of problem, whether it's wax or dead skin, usually pushed right into the back of the ear where they've used a cotton bud or they've been using cotton buds for years, and this is a typical case of that. So this some Bart's hook that I'm using is a manual instrument which is just helping me to just loosen this piece of dead skin into the back of the ear. So you notice what I'm trying to do is just trying to lift it away from where it's adhered along those lateral walls, and just using almost the butt of the some Bart's hook just to create a little bit of movement and just to start to loosen it. So of course, because it's been in the ear for a long time, it normally adheres to those lateral walls, and it's almost like a glue which requires a little bit of gentle persuasion to sort of move away. So I'm using a combination of things here. So I'm at the moment using the sodium bicarb just to loosen things up a little bit. In a second, I am going to go back in with the Zollner pen just to get a little bit of lift from that inferior part of the ear canal. So I know it keeps cutting in and out because this was a 3-part video that we merged together, and this is us going in with the Zollner suction pen. Now the suction is usually quite gentle, so you see I'm just trying to lift from this inferior part of the canal. This is this is actually the anterior recess, so this piece of wax has now lodged itself in this little ditch just before you arrive at the eardrum. So there's a little bit of sideways movement there. I'm just trying to almost wiggle this piece of wax out, and you see it's starting to lift itself off. What's making the procedure a little bit more cumbersome and difficult is the fact that I am not using olive oil or sodium bicarb, which was at the patient's request. Despite me advising that it might be sensible, the patient wasn't overly keen because of the history of infection in the past. So now we're starting to get that little bit of lateral movement, and I'm using a rocking motion just to start to bring it away from that recess. And you can see the anterior part, that dead skin, is just starting to come away. The key is obviously being super gentle. We don't want to be knocking any part of the back of that canal, especially that inferior bony canal, which is very, very sensitive to touch, and it can be quite painful. So this is me switching now to my third instrument, which is a pair of Pheww grips. So you notice the key with this is just getting enough of a grip to try to sort of ease the plug out. Not always easy if you're not using an endoscopic camera. A lot of practitioners sometimes use loops, and I can imagine it being so much more difficult with loops because you don't have that same depth perception, and the procedure isn't always as comfortable because you do end up knocking the ear canal or the bony canal just because you don't have the same integrity of view and depth perception. So as this piece of dead skin is now just coming away, that's me just nipping on the end of that piece of dead skin just to try to get that lift. And you can see I've just lifted it off that inferior part of that bony canal, and it's just a case of being gentle, persevering, and taking your time. So we're just trying to get a good enough grip to, there we go, we got a nice chunk there that's just come away. So again, you can see it's still bedded quite deeply inside the ear, and again we're very close to the eardrum here, and that's me going in a little bit further, and there's that lift on that lateral right canal wall, and there's another large chunk that's just come away. And finally we're going to go back in with the Phewws again, and this time just in the roof there I've got enough of a grip for the whole thing to come away. And that is how you remove a dead piece of skin from the back of the ear. Please subscribe, follow, and comment. Be more than happy to respond back to your questions. Thank you.